Hello, I am Dr. Stephen Lawrence with the Infectious Diseases Division at Washington University School of Medicine. As the COVID-19 vaccines are rolling out across the country, one of the most frequent and important questions I've been asked is, now that I've been vaccinated, can I go back to living like it's 2019? After all, the two currently available COVID-19 vaccines truly are awesome. They reduce the risk of getting sick from COVID-19 by 95%. That is better than almost every other vaccine ever produced for the prevention of any illness. Unfortunately, though, the situation is not quite that simple at this point in time, as we are nearing the end of January 2021. For the foreseeable future, we will need to continue using the mitigation strategies that we know work, particularly always masking when around people who are not in our pod or bubble, maintaining distance from others, and avoiding large gatherings. We still need to do these things for at least two reasons. First, even though the vaccines provide 95% protection from illness, it still means that 5%, or 1 in 20 people, who had a high enough risk of exposure will still get sick. And when there are more people around us who currently have COVID-19, like now, when there is a lot of community transmission, the risk of being exposed to a person with COVID-19 is much higher than when there are only a few cases in the community. Second, while we know the vaccines prevent illness, we don't know quite yet just how effective they are at preventing asymptomatic COVID-19 infection. So it may be possible that you could still become infected and spread it to others without knowing it if you are not taking appropriate precautions. Plus, there is a practical matter. Until community transmission drops to low levels, the community public health measures will need to stay in place to protect the entire population, particularly those who have not yet been vaccinated. Allowing those who have been vaccinated to go around unmasked or having large gatherings could lead to altercations, inequities, enforcement challenges, and could lead to transient increases in community risk if many people who haven't yet been vaccinated claim that they have and relax their mitigation behaviors. Some might ask, well, why bother getting the vaccine in the first place if I still have to mask and distance? Well, first and foremost, it protects you from getting sick. And it can provide more confidence by further reducing the risk of infection associated with currently allowable activities that entail some small degree of risk. For example, after vaccination, you might feel more comfortable going to the grocery store, while still wearing a mask, of course. Eventually, we'll be able to relax our public health mitigation measures, and the faster we can get vaccine into people, the faster that will happen. Our public health departments will tell us when the transmission rates are low enough to safely resume more social activities, at which time the measures will be slowly peeled away, layer by layer. So until the pandemic wanes, we must carry on with our current precautions and keep working together to keep our community as safe as possible.